Northeast Indiana Regional Partnership, and we're really grateful that you're taking time to join the session today. These sessions have been widely viewed and widely praised for the value that they're adding in terms of applying principles important to reopening our economy in many different applications across Northeast Indiana. So I'm grateful you're taking the time to be with us. I want to take a moment to thank the partners that have made this possible. It's just been a real pleasure working with Parkview Health, Greater Fort Wayne, Inc., also the team members from the Regional Partnership, and notably the Allen County Department of Health. Special thanks to Deb McMahon and Mindy Waldron, who've been on every one of these sessions answering questions from the Department of Health, and also Heather Shagler with Parkview and the complete staff at Greater Fort Wayne, Inc., who've done a tremendous job pulling this together. And a great deal of time has gone in to prepare what we believe are very meaningful sessions. Got great reviews and feedback. So we're really appreciative of what we think is a best practice in Northeast Indiana to share this information across our 11 counties and even broader. A little bit of housekeeping. Please hold your questions until the Q&A session. You'll see at the bottom of your screen, there's a Q&A tab. And when we get into the Q&A session, we'll make that live so that you can give some questions that may come up during the session. We really appreciate those who have submitted questions in advance so that we can prepare responses given the expertise of the Parkview team that's joining us today. And immediately following, it'll surprise you how quick it comes. There you'll receive a link to the slides and also a link to the recording of the event and a survey. So that survey has been really important in terms of framing how we do these sessions on an ongoing basis. So we look forward to getting feedback right away. So we're going to start here by introducing Jolynn Suko, the Chief Innovation Officer with Parkview, and she's going to lead off the Parkview team and get us rolling into the session. Jolynn?
Thanks, John. John said I'm Jolynn Suko, and I have the privilege of serving as the Chief Innovation Officer for Parkview Health. And what a time of innovation the last 10 weeks have been. We're coming to you today from a socially distanced studio, makeshift studio in the basement of the Marrow Center, all many feet apart with hand sanitizers everywhere, and all feeling incredibly grateful for all of the incredible hard work that the members of our community, our higher ed colleagues have done to keep the spread of COVID as manageable as possible. And also here to share with you a little bit about how we're doing and how we're seeing this in the next 12 to 18 months. So we are slowly and methodically getting back to business. Some assumptions that we've made in our getting back to business plan is the virus today is now here and it's part of our community. It's not limited to one place or area, and it's much harder to pinpoint the source of outbreaks. We also know that a vaccine is at least 12 to 18 months away, and there is no herd immunity. So as we think about reopening, we want to reopen as safely as possible and to keep surges as low as possible. At Parkview, you may think of us as where you come to get your health care, but we're the largest employer in the region. We have a large grounds crew, we have an education crew, we have 10 cafeterias. We certainly have the hospital beds and towers, not unlike a dormitory. So over the last 10 weeks, we have been implementing and evolving new practices in a very dynamic information environment, and we want to share some of that with you today. We're here and we're ready to serve. We're really monitoring this situation very, very closely, especially as we open back up. We're restarting our services very gradually, and we still have visitor restrictions in effect. We've also launched a service, Parkview Business Connect, to share a little bit about what we've learned and the best from others. We know that information right now is very dynamic, and this webpage is designed to be a living, breathing document that we update weekly and sometimes daily with best practices, tips, and tricks, and industry-specific guidelines, whether they be from the CDC or from outstanding corporate practices. As well, we recognize that educational institutions across the entire spectrum have unique needs, and we're developing a playbook specifically for higher education on safe practices, and that's going to be coming out probably this week. So please be out and looking for that. We have a hotline that you can call, 260-CONNECT, where we will connect you with our subject matter experts within a day about specific questions that you may have. And we want to be in dialogue with you as we transition to this new normal. So with that, John, I think I will turn it back to you.
And you would like me to unmute and turn on my video and be prepared. So here I am back. Just to keep all this in context, the entire state is under the plan that's been published by Governor Holcomb, our Back on Track plan. And it's important to remember that this is us doing our part to get the region's economy going and up and running in a way that we continue to pursue our Vision 2030 goals and the long-term health, not only of the community and individuals, but also the health of and vibrancy of our community in terms of the way the economy is working. Governor Holcomb has been very clear about there's guiding principles that we're applying to the reopening activity. This is not just reopening without regard to the health implications and our healthcare systems. So there's 4 guiding principles. Don't hesitate to look these up on the Back on Track website. But clearly we're watching the number of hospitalized COVID-19 patients statewide to make sure that they are decreasing over a 14-day period. The state retains its surge capacity for critical care beds and ventilators, making sure we have the equipment and supplies required to respond to COVID cases. And the state retains the ability to test all Hoosiers who are COVID-19 symptomatic. And finally, we want to make sure that we have a system for tracing individuals who may test positive in the contact with any other individuals that they may come in contact with during a day. So those guiding principles will be the overarching metrics that we follow as the state's economy opens, and clearly as our region's economy opens. And you'll also note that we are now in stage 3. We're enjoying the benefits of getting back into to our communities and doing things more openly, but we do have to follow principles to ensure that we're protecting the health of our fellow neighbors and residents, and that we're keeping the COVID spread under control. But you'll note we're in the May 24th to June 13th period, and several activities have opened up statewide, and yet still some activities are being controlled. It's important that we stay vigilant and disciplined in terms of how we approach this so that we can make sure we don't violate the guiding principles. And we look forward to June 14th when we hopefully we will move on to stage 4 as the state's economy opens up and we bring more participants back into daily living. From a Northeast Indiana perspective, we're doing everything we can to share information across community borders, and we have so much relevant experience to share. Many of our manufacturers and industries and businesses have been open throughout, and they've learned practices. So those we've been sharing, and you'll see here a list of the various sessions that have been recorded and are now online that you can draw and take advantage of at any one time. Don't hesitate to visit the webinar at the GFW website where all this information is recorded. You can see we've done a number of these sessions, and there are some more yet to come. With that, I'm pleased to introduce Dina Jackway, the Chief Community and Human Resource Officer for Parkview. Dina?
Great. Thank you, John. So as we think about the disruption that the last few months have entailed, and as Jolynn said, Now is a great time for innovation. And as John talked about the Back on Track plan, this is a great time to talk about what are those workplace and people considerations that we need to be keeping in mind. People are the most valuable resource that you have, and you have students, you have families, you have your faculty and your team members. And so as you think about all of those, there's a few points that we want to make. First, on your preparedness plan, making sure that you have this workplace coordinator. We know that, for Parkview, we have an entire incident command center. We know that for smaller organizations or perhaps small universities or large universities, you're going to have a number of people as part of your incident command or your point person. But making sure that you have someone or a small team who is dedicated to making sure that they're knowing all of the new information coming in and helping communicate to the constituents and to the parents and the families of your students, because that communication is what they're going to see and how they're going to expect their children to experience campus life. They're having a lot of other pieces of information, whether it's national news or social media. A lot is coming their way. So for you to be able to cut through all of that and say, here is what your child's experience will be on the campus and how we're protecting them is going to be critical. Blessed are the flexible. One of our Parkview leaders shared that with me early on in the pandemic, and it rings really true. We have had to be so flexible here, and in turn, we're asking for flexibility of our team, and we're giving them as much flexibility as possible. So building flexibility and fluidity into your plan is so important, because what we were doing 4 weeks ago or 6 weeks ago, very different than what we're doing today. And so it's this constant evolution of being able to be flexible and adapt to what's happening. You're going to have to do that during the school year. As July comes and you begin to communicate more with families, and then you have the fall and going into the year, there's going to be a lot of different ways that people will have expectations as to how they're getting their communication, but how things are changing. So being very flexible is important. Consider all of your policies and practices. Cannot stress this enough, because you want to be as proactive as you possibly can, as opposed to reactive as a situation occurs and then you have to go out and communicate, well, here's how we're going to handle it for the future. Trying to think through all those scenarios up front is going to, again, help put parents at ease, put students at ease, and your team members. And then I think we would all agree that, and I know the word new normal is certainly being overused, but the point here is, what are you going to carry on into the future that is a new best practice that you're finding? Great technology has been found, and we were just talking this morning at a board meeting about the fact that we're using Microsoft Teams and we're able to see each other. And does this allow us the ability to bring lots of people together virtually versus physically? And so can we continue that as a best practice? And virtual visits for healthcare, but there's a lot of those things that we've seen that you will see as well. I mentioned this earlier, but I just want to hit the point again. Communicating and educating, not only how you're keeping people safe, but how they can keep themselves safe. What are the hand hygiene expectations? I know today we're going to talk about masks, and what are all the things that they can do to keep themselves safe, but also what you're going to do as an organization and university to keep them safe. The most powerful tool you have is questions, asking curious questions, being able to reach out to your team, your faculty, and ask them what is it that they need, or what is it, how they're feeling. What are resources that they don't have that they do need that would make their jobs easier? What are some barriers that they're having? Those are going to be helpful for you so that you can provide a better experience to the students and to them. And then asking the students and parents, because we know Wall Street Journal just had several articles in the last couple of days about returning students. And that is really, we know the parents are so influential in sending their children to school. And so because of that, you're not only communicating, obviously, with the students, but their parents and families as well. So asking them and getting their feedback along the way is important. one of the pieces that, and it's not so much important as to what's on the slide, but more about making sure that you have a process. When we talk about keeping people safe, when you have, and you will have ill students or ill family members where students have been exposed, how they're coming back, or faculty members that have been ill, how are you going to work through that process to have them return to work or return to school? And so doing that and having that set up front will be helpful so that you're able to share that, be very transparent about what you're doing, so that as a student is returning or a faculty member is returning, they all know what they're going to experience, how they're going to experience it, and other, obviously, students and faculty see that you're keeping everyone safe. So that this is just an example of our process, which we went through several iterations to get to what we feel is really the best process for us. And we're certainly happy to partner with you in the Business Connect, as Jolynn mentioned, to help work through your return to work process and return to school. So now I'm going to turn it over to Dr. Nip, who's our Chief Medical Officer for Parkview Total Health.
Thanks, Dina. Hi, everybody. Dr. Mike Nip here with some specific insights to help keep your process going regarding higher education. So just like was mentioned a little bit ago, the workplace coordinator, or a team that serves and covers all bases for that, is extremely important. The kind of calling the lifeguard to set everybody back in the pool, but going through a very step-by-step process to say, are you ready to go back in, is important. July 4th, as we saw on the framework plan, is it's a mile marker, but it's not the finish line, because we're trying to encourage industries, employers to find long-term solutions that will be sustainable from now on, incorporating practices that maybe we should have been doing all along, but now it's hyper-focused on. They're good ideas now and will be in the future. So this slide here is a very core slide to what we've been communicating and partnering with employers. It's regarding this hierarchy of controls. Now, what is this? So it's from the industrial hygiene literature, and it's an approach to any exposure. This could be fumes, this could be a virus, this could be something else. What it does is it starts at the top with a framework of solutions to approach that a specific workplace could take to optimally create a workplace that is healthy and optimally safe for the people that would be in that space. At Parkview here, we're calling it more than a mask, because at the bottom there, you can see PPE, which is a word we're now all familiar with. That is the last piece to the puzzle, not the start and finish. Another slide here, just to highlight a couple things for specific things to put into practice. For example, elimination, you know, if an ill person is not in the building or out on campus, that is a practice to ensure or optimally make so that exposure is not going to happen. Engineering controls generally regard affecting the physical environment. Administrative controls are regarding how people work. And these slides are available afterwards to dive a little bit deeper into specific strategies. And then down at the bottom again, for example, with PPE, regarding, for example, masking or other strategies to keep people safe. I did want to point out just 3 things that any time you can, higher up in the hierarchy is the focus to start there. We want to make these solutions as automatic and easy for the person to make the optimally healthy and safe choice as we can. I'm going to also ask to look inward for your innovators. It could be a freshman, their first day on campus, has an idea, or someone who has fresh eyes, as everyone coming back is going to have fresh eyes at the buildings and the campus. Quick slide here. If there's a couple takeaways that we could give, this is from CDC, as you can see. Here are some basic steps that everyone can take regarding, again, the staying home when sick, cough and sneeze etiquette into the elbow, cleaning and disinfecting the frequently touched surfaces. And then again, the biggest one we all learned in kindergarten is washing your hands. Soap and water preferred, but it's not always available. And so that means we go to the alcohol-based hand sanitizer. With that, I'm going to turn it back over to John for some Q&A.
Thank you, Dr. Nip. I appreciate it very much. And just a reminder, everybody, Parkview has a number of professionals in the room, including Dr. Board and many from their education OD teams. And so they are fully equipped to get into any area that might come up. And please note, again, Q&A tab at the bottom of the page. We'll try to get as many questions as possible. We're going to start by feeding off of the questions that were submitted in advance. And some of these are really good questions, very practical, how to apply the same principles again and again to different applications and environments. So the first one we're going to jump into, how do you offer education in a classroom environment while keeping staff and students well?
Good morning, this is Matt Holycross. I am one of the education and training managers here at Parkview Health. Really, the first bullet point there is, just like we talked about the hierarchy of controls, if you have ill staff, faculty, students, they should be staying at home. They should not be attending class in person. This is more important now than ever, so if they have any symptoms or feel ill, they need to stay home. As we move through some of the other bullet points, a lot of them, again, are just reinforcing the hierarchy of controls. Obviously, if you can maintain social distancing, you need to do so. We need to look at maneuvering desks, chairs, anything in the rooms to allow for social distancing. Utilizing any type of visual indicators for distancing is great as well. And you also need to look at alternative classrooms. So there may be larger conference rooms, maybe even an auxiliary gymnasium that's available. That could be utilized for some of the larger lecture classes. And then really for your faculty, they really need to look at their curriculum. So planning in advance for a mixture of in-class as well as remote learning opportunities, anything that can be done virtually, whether it be a live stream, some type of webinar or lecture, they should plan to do that in advance and have those built in throughout the semester, whether it be during a potential surge or just if the student or even the faculty member is ill, they can either live stream from home for those students that are in class and or vice versa. And then lastly, really, again, that reinforcement, providing and encouraging hand washing. We'll talk a little bit more about masks here as well, but just again, just the continuous reinforcement of those pieces. And then the last thing that you may want to consider is based off of your class schedules. If those are rooms that flip fairly quickly, so maybe 15 to 20 minutes between class sessions with professors and students coming in and out, you may want to look at changing your schedule around a little bit to allow for cleaning between sessions. And then also just looking at restricting class sizes, smaller groups, or even flexing the offerings of some of the sessions throughout the day, weeks, and months.
Thank you. And you mentioned the masks. So we've got to ask the question right away. Should we make masks mandatory for staff and students?
Hi, it's Dr. Nip. So this is probably the most, if not the most frequent question we get. We, first bullet point there, talk about more than a mask. I'm in my talk saying, you know, road safety is more than a seatbelt. So just because you have a seatbelt on doesn't mean you're done. So the same thing as Matt was saying just a second ago, as high up as you can. Good hygiene, clean hands, touch face. If they touch face, those sorts of things. I would proffer mask, as we say, their individual choice, encouraged and supported. With any employer or institution policy, obviously if it's mandated, there has to be, like I said a couple minutes ago, easy-ish way to help those folks make that choice and be able to comply. So as we have here, providing masks for staff and students here at Parkview, recently we provided 3 washable cloth masks. for people. To get college students to do any laundry, let alone wash a mask, good luck. But again, it's making those available. It's trying to, just like to keep hands clean, making it easy-ish to put hand sanitizer, classroom entrances or buildings, those sorts of things. Make it as easy as possible to make that optimally healthy choice.
Very good advice. Very good advice. Next question. What is the best practice for cleaning classrooms, shared spaces, and dorms?
All right, Dr. Nipp again. So what is helpful is the CDC and EPA have put out recommendations, list of cleaners, because the detail is important. There's certain cleaners that aren't effective. Quat ammonium is one of those. But there is available options out there. It may mean that the facilities folks, or even if we're asking faculty and staff to take care of their classroom, again, making that easy for them to do. Hand sanitizer stations, like we said, where you want clean hands to be, put those there. Increased visibility and use. I would also echo a very core point is from the top down. This is university president, this is director of a program or college is doing that and making it very obvious they're doing that. Encourage students to participate in cleaning their personal spaces. Flashback into my dorm room, wasn't pretty, but again, please, you encourage it and make it available. So that might be dispensing a cleaning kit to the students as they come back on campus, or making it easy where they could get to those resources, as well as revising or revisiting the general cleaning or general space cleaning that would happen in a dorm or some other sort of shared or common space.
Great response. And again, I love the theme here about making it easy to do what needs to be done. That's really good counsel. Next question, what are the recommendations for students per square feet? In other words, population density in our classrooms and other shared spaces.
This is Matt Holycross again. Again, keeping that 6 feet of social distancing as your standard. Also taking into account where we are at in any phased return to limit the total number of individuals in a room or confined space. Obviously, every classroom is not designed or developed the same. So, if you have computer labs, if there's any type of hardware, chairs, anything that you can remove from the room to further deter individuals from sitting close together, please do that. You may need to look at traffic patterns, not only in the classrooms, but maybe in the hallways, depending on the building that they're in, to make sure that traffic also can flow with that distancing, and maybe even looking at how do you implement different wings of buildings at different periods of time to, again, allow for cleaning before and after classes. And then again, as we've talked about before, the reinforcement and the promotion of hand hygiene, respiratory etiquette, and then lastly, students and any faculty staying out of the classroom and out of the buildings if they are ill.
Well, before we leave this question about population density, there is a question on the live chat about, or the Q&A tab about regarding housing. Is there guidance on whether or not de-densifying residential housing? I guess that must mean spreading students out in the housing areas for the purpose of social distancing. Is that encouraged? And is this concept effective since there's very little control over student behavior choices while in dorms and apartments?
Dr. Nipp, you're a tough one. I'm getting all the, where are the softballs, John? Come on. I mean, again, I think I am trying to do whenever I chat, what we're trying to do with these is to give advice and be cognizant of individual situation for organizations, because we could say, ideally, one student per room. Realistically, I don't know if that is an opportunity each institution has. Again, once it's in their room, I think within residential policies, the institution has only so much reach it can do, so much it can control. key premise of this is looking at each space, each process, what can the organization control, what can they not, what should they not? And I think there could be, again, encouragement, make things as easy as possible for them to keep that space clean. But again, once it's in their personal space, there's no way an organization can 100% dictate practices and those sorts of things. So I don't want to say the I word, but I'll offer it impossible to socially distance a dorm room with 2 people in it. That is, I just don't know how you happen unless you're knocking down walls, re-square footing everything. If there's opportunities for, 1 per room, obviously that in theory would work, but I just don't know if that's going to be realistic for most places. I wish I had a better answer, but it's a head scratcher.
Thank you. And I'll save all the tough questions for you, for sure. Next question. What are some creative ways schools are planning to open in the fall?
Matt Holycross again. As you've seen in the news, several higher learning institutions across the country have made several announcements, whether it be starting the semester early to be able to finish up by Thanksgiving. Really anything that you can do to minimize students and staff from leaving for long periods of time or maybe socializing outside of the campus. So it may be minimizing or eliminating the fall breaks, any of those types of short breaks where it encourages students to maybe return home and come back. There's just less interaction outside of campus by doing so. Talked about before as well with classroom learning, looking at alternative locations on campus to be able to hold some of those maybe larger lectures. And then really just in general with classes, just alternating or looking at alternate schedules, whether it be a Monday through Saturday, in person, maybe smaller groups, or splitting groups into, this week, this group will come in and take this in-person lecture. Next week, the other group will do this and vice versa. And there could be online learning for those groups when they're not in class. Then if you look at any of your computer labs and any of those types of labs, just again, looking at the schedule to still allow for some of that hands-on where it is truly critical, but to minimize the amount of students in and out of the buildings.
Excellent. What is practical advice on keeping independent young adults socially distant on a college campus?
Dr. Niv, I'll start. I think, again, this goes back to the dorm rooms on the non-directly controlled small C time for the organization or the higher learning institution. Kids going to be kids. We know that. And I think we, again, promote healthy choices, model, make it obvious. Is the school mascot wearing a mask and pretending to wash their hand in every game? Maybe. That's just a random idea I had. But also, the statement we have at the bottom, I want everyone to keep in mind, don't miss the good for the perfect, because a lot of times that juice is not worth the squeeze of policing masks or hand washing every time. It's trying to, again, make it easy to do the optimal choice. The other current that is present is the social and or peer pressure. Because again, in our region and others, 2 months ago, someone wearing a mask was reacted to the same way as someone not wearing a mask now out in public many times. That the social norm has shifted. And so I think it might be an expectation to regularly expect to see that behavior, and it's going to be the outlier if you don't. And we know what, outlier plus that age group can be. They don't want to be an outlier. And so we get where we want to be for that reason. Dr. Board, any additional thoughts?
Yeah, this is Dr. Board. So I think one of the things to help, you want to, first of all, explain the why, right? So all of these measures are not just to keep that individual student safe, it is to help keep other people safe as well. So one of the things that we know that can happen with COVID-19 is that people can spread the virus if they are asymptomatic, you know, in this time frame between exposure and the onset of symptoms, or they're minimally symptomatic. So maybe they have symptoms, but they're not severe. And so when you stay home, when you're sick, when you cover your cough, if you wear a face covering or mask in public, it is to protect others from you. And you are, you know, it's, as Dr. Nip mentioned, it's like traffic laws. If most people follow them, they're effective. If most people don't, they're not. The other thing is, it's important, just like we do in our own organization, is to walk the walk. So are your staff, are your faculty demonstrating the safety behaviors necessary to keep them and others around them safe? So if your staff, your faculty are maintaining social distancing, performing hand hygiene, all of those things, it's going to help reinforce those positive norms that you want to promote on your campus.
Really good. I'm very aware that we're trying to change a lot of habits here. And so reinforcing and modeling those habits is really important for all of us. Let's go back into the unique perspective for higher ed and residence halls. How do we open residence halls while minimizing the spread of COVID-19?
Dr. Nip here, I'll start, and anybody else can chime in. Again, what's good is there's a playbook from the CDC regarding some recommendations. You know, and there will be, again, what is going to factor in are obviously federal, state guidance on what has to happen. If the county in which your institution is in has specific requirements, if you have locations in different counties, you may have to adjust. But there will be some students that per physician order, local health department order will need to quarantine or isolate. To unpack those real quick down the slide there, isolation, someone who is sick, not around people who are well. Quarantine, it's, you know, watching them, separating them out, but they're not necessarily ill at that time. So the plan needs to go into place to how can you do that. And the important point I think there is cannot return home to do so. That may not be an option for many students based on their where they call home. Again, it might help to make this an easier, because it's going to be a tough time for that student, their family, and the organization. Can you provide them with things like personal care? Can there be quasi-concierge that could deliver food for them from the cafetorium? If they can't, don't share utensils and restrooms. Again, try to, as best you can, given the resources and the facilities you have, try to limit access to anyone who is there.
So this is Dr. Board. I just wanted to add a couple comments. So really, the fundamental principle here is, as a society, we have to accept a certain amount of risk. COVID-19 is in our community. It is worldwide, and it's not going away. So if we're going to leave our house, we're going to have to assume some level of risk. But the risk can be managed, and it can be greatly mitigated by sensible, by sensible actions and processes and procedures. So there's behaviors, there's engineering controls, and other strategies that can be used as in aggregate to greatly mitigate that risk. But there's some level of risk. Just like during flu season, there is some risk that you may contract influenza when other people are ill, but the similar behaviors can greatly reduce the spread of influenza in a given area or community. So, at the end of the day, it's not going to be a situation where you're going to have hundreds and hundreds of students that are going to require isolation or quarantine. It's going to be a very tiny fraction of individuals of your total student population that may require these measures. The key is to have a plan and to make sure that your student knows when they have onset of symptoms what to do to implement that plan. Who do they call? Where do they go to student health? How do they seek medical attention? What are the measures that they immediately need to do? If they have a fever and a cough, first point is don't go to class, right? Don't go to class. that greatly mitigates the risk of exposure. Now, you may have to make some arrangements for that person's roommate, but if they've done all of the other standard social distancing measures, the likelihood that you're going to get spread to multiple individuals is actually quite low. And so it's really about using those measures consistently and having a plan so that if someone becomes ill, which again, COVID-19 is in our community, it will be with us for the foreseeable future. One of your students or more are going to become ill. It's going to happen, and it's just a reality. Just like we have to deal with it in our workplace, we have to deal with it in our schools.
Very good. Next question then. Should we be screening staff and students prior to every class or arrival on campus?
So when we say screening here, really the best way to do that is just simple self-assessment of signs and symptoms, right? In other words, each day, what you want that student or staff member or faculty member to do is, do I have a fever, cough, shortness of breath, or other signs or symptoms that I may be ill? If I have one or more of those signs or symptoms, then I need to have clear guidance on what do I do next. The first thing is, don't come to work or school if you are ill. And the other thing is if I have signs or symptoms, then what do I do next? How do I, should I stay in, if I'm in a residence hall, should I stay in my room and call a number? Do I go to student health? What do I do? So it's important to have clear guidance on what happens if someone self-screens and they self-identify that they have signs or symptoms. If you have a patient or a student or staff member that is identified with COVID-19, you may need to interact with your local health department to identify other individuals that are at risk and help support things of what's called contact tracing when it's appropriate. But I think, again, the key is making it easy to do the right thing. There are organizations and schools that have apps, for example, to help facilitate online applications, to help facilitate self-screening.
Then the next question is related to that. Should we be doing temperature checks upon arrival to campus or prior to entering buildings or classrooms?
So this remains, John, a hot topic, pun intended. So we have the statement there that, this is everywhere. Facebook, Dr. Google, on the news, you got to do it, you got to do it. So the statement here that we addressed this in a working group here back in March, looked at the evidence, and we're prescribing a lot of hard to swallow pills this season, and the one that we did was it just does not work to prevent COVID from getting into a workplace, anything like that. This was a study, as you see there, Dr. Gostick in 2015 and 2020, looked at past pandemics. The numbers were disappointing. From 2015, looking at screening in Australia, inbound 1 million passengers, they found 4 cases of SARS. It was very low yield. Other things too is the amount of resources, both direct and indirect. It uses PPE. You're going to expose that screener to multiple person. There's a lot of high volume of protected health information. That temperature, it's a vital sign. How are you going to manage that, protect that, and keep it where it's supposed to go? We basically at the bottom, we say we don't recommend it as part of a COVID-19 surveillance program. We understand, I'm speaking for the room, that if it comes down from a regulatory body to say you must do, there are ways to potentially get that going. But again, we try to reach out to those people saying you must do and help them understand the reason that other measures are going to be more feasible. And if we want to use the right tool for the job, and if the tool doesn't work in other situations, we wouldn't use that tool. And I think that applies here.
Yeah, and just to add to that, so some of the why it seems like it should be helpful to do widespread temperature screening. And the question is, well, why is it not effective? Well, there's a couple reasons. First of all, and probably the most important is that we know from medical studies of large groups of patients with COVID-19 up to 50% of patients who have early symptoms do not have a fever early in the course of their disease. There was a very large study of patients who presented in China where the COVID-19 outbreak began, and as many as 50% of the patients on the day of admission to the hospital did not have a fever. Most of them developed a fever later in the course of their illness during the hospitalization, but when they walked in the hospital door with cough and other symptoms, many did not have a fever. So that's the problem. They may not have a fever. The other problem is that temperatures can vary for a lot of different reasons. So I may have just taken ibuprofen or Tylenol, and that will suppress my fever before I came into work or school. Temperature, particularly contactless temperature sensors, have a fudge factor of plus or minus 2 degrees. So if my temperature is really 100 or 101, the contactless temperature monitor may say that I'm 99, in which case maybe I'm okay, according to the temperature monitor. So there's a lot of reasons why this is not as effective as we would want, but the bottom line is it's just not a good strategy to employ.
Excellent. And now we're continuing to dig in on some of the unique perspectives or aspects of educational life, and that is crowds and gatherings. How do we design the campus to minimize crowds and gatherings of students?
This is Matt Holycross again. As I spoke before, even with the classrooms or in the hallways, any type of visual representation that you can give individuals. I mean, as you go out in public now, if you go to the grocery store or anywhere else, there are stickers or placards on the floor of where you should stand. Anything visually representative is going to help. You may want to look at some of your higher traffic areas, whether it be some of the administrative buildings, and where kind of the normal traffic flow is, and looking at how you can separate the traffic flow to minimize any cross sections, intersections of that sort. You may also want to consider the limitations of access. So if there are facilities on your campus, athletic center or athletic rec or weight room, fitness center, something that you may currently have general public access to now, it may be something to consider to temporarily limit that to only students and faculty to, again, that just minimizes other outside individuals in that area on campus. And as we talked about before with the classrooms, this really goes for really any room or location. Anything that you can do to minimize or reduce seating, or even just spread out a room. So if you have maybe some decorative plants or other things that you may normally have in a general area, it may be time to move those out for the time being, just to, again, open that space up to allow for individuals to socially distance.
Very good. And then again, another unique perspective of the labs and welding and CNC machining operations. Are there additional considerations for that hands-on practical training like these labs and welding education, CNC training that might be going on in various institutions?
Yeah, again, we always start with the hierarchy of controls, following those. So again, and we actually have to utilize a lot of this here at Parkview, whether it be in some computer lab classroom training. We've had to minimize the number of individuals in a session in a lab, which sometimes that means we may have to offer, instead of 2 to 3 lab sessions, we're offering 5 to 10 to make sure, one, that we can get staff through, we can clean between sessions, and still get everything done that we need to. Unfortunately, there are some things you cannot do virtually, or the virtual piece, that hands-on piece really needs to happen. So those are in some cases really great learning opportunities that we can't do virtually or via a webinar of any sort. So just, again, taking those hierarchy of controls, minimizing the class sizes, spreading out the offerings, or even extending some of the hours of the labs, whether it may be a normal lab that is done Monday, Wednesday, and Friday. It may be a a Thursday, Friday, longer day for that group, and then you bring in the next group Monday through Wednesday. So just, again, looking at what you can do to move your schedule around to be able to accommodate the hierarchy of controls.
This is Jolynn Suko here again, and the STEM lab falls up under me. One of the things I think at the curriculum level that you can look at is, are there things that can be done virtually? So we were laughing as we were preparing the session because some of us took genetics 25 years ago where we had to breed fruit flies. A lot of that could have been done in a virtual simulation. We are now in the simulation lab here, have kits for suturing that we're mailing out and doing some webinars and doing a checkoff. So really, if you look curriculum by curriculum and start to be creative to say, can this learning take place either virtually or some combination of virtually, in person, by Zoom, there may be some topics and subjects that you could deliver in a different way.
Really good points. And continue to extend this. Should we allow students to continue with internships, practicums, and student teaching, those kinds of educational experiences?
Dr. Nipp here. I mean, I think definitely the opportunity for them to continue is there. The same expectations of wherever they are doing that experience should be, I would say, non-negotiable for your home institution. Ill students obviously should not be present at like we've said, a class or for their internship session. And again, the bottom point is very important. Is the host location, how on the ball are they, for lack of a better term? Are they ensuring your student is going to have the optimally healthy experience there? If yes, I think you can cautiously continue to do that. I would also encourage a way for that student to give feedback to you about what they are seeing, because obviously you want them to feel safe and protected in that experience. If the answer is on the outset, no, they're not offering on the surface anything, probably to look for a different venue for that student. If it pops up during that experience, allow them a way to not have to continue that, and an alternate plan is in play. But also I think it's going to be a partnership with host institutions and sending institutions to make sure everyone's on the same page.
Thank you, Dr. Nipp. The next question I want to draw from is from the Q&A tab. And this is an interesting question from Matthew Hall. The CDC recently stated that COVID does not transmit easily from surfaces. How does this fact impact the need to clean surfaces?
So I'm going to offer an oy vey to start, because this is another thing that got, I think, stretched and taken out of context by the popular media. I don't think they said easily. The focus still is primarily is the respiratory process, coughing, sneezing, that sort of thing. It's out there to say, in theory, if someone had coughed on a surface, can you touch that surface, touch your face, eyes, nose, spread that way? I just checked up to date, which culls all the medical literature about 10 minutes before here. The jury is still out how long it still lives, quote unquote, on surfaces. Expect higher chance in places where there's higher doses of the virus, healthcare settings, something like that. As we know, I won't get into testing too much, but for brevity's sake, presence of viral RNA does not correlate necessarily with infectivity. The line I'm going to quote from them to say, even if you can detect viral RNA off a surface, does not correlate with infective property. Having said all of that, it still does not change the position. You should clean high-touch surfaces and other surfaces regularly according to CDC guidelines and with FDA-approved products.
Yeah, the good news here is that you know, the virus that causes COVID-19 is not a difficult virus to kill using standard approved cleaners. You know, having a good cleaning program and managing those high-touch surfaces is very effective in eliminating virus.
Excellent. The next question again is from the Q&A tab, and a follow-up question with Francisco Ortiz. If we have a floor in a housing unit designated for isolation housing, and that floor only has one common bathroom, is it still okay to assign multiple isolated students to that floor even if they are sharing the common bathroom?
Sure, I'll take a stab at this one. So amongst the bitter pills to swallow is we're looking a lot at the 1918 playbook, and this is a very old technique. This is isolating or cohorting patients or people with the same illnesses and symptoms. I think if that's available to your organization, it's worth looking at having an ill section or ill floor. A shared bathroom, I think it's going to be an unavoidable facility reality. Again, we do the best we can. I wanted to pull in real quick a talk about a secondary attack rate. This is if you're around somebody and they have it, how likely is it that you will get it? Studies out of China I've seen puts that at about 15%, and this is household, mom has COVID, mom tries to stay away from everybody else, uses her own towels, dishes, glasses. It's not a high attack rate. And even more so if people have the same symptoms. It's not that we say, well, just, free for all, but again, you try to at least consider this cohort idea. It'd be worth looking at. And then try to control sharing of spaces and items, cleaning as you can, but also pay extra care and attention to the workers that will be in that environment, be it cleaning the facilities, bringing food, those sorts of things, putting in proactive policies to ensure they feel safe, and how you will help them continue to monitor themselves, knowing they're going to have a higher than background exposure level as they go in and work.
Super. And I'm watching the time here. We've got a couple minutes left. And so when I kind of push through some of these questions that have come up repeatedly in some and other applications, should we be planning for another surge in the fall or spring semester?
Dr. Board, would you like to
Yeah,
start?
this is Dr. Board. So we are actually already starting to see an increase in hospitalized patients with COVID-19, particularly over the last 7 days. The other health system in our region has also seen a similar increase. This is actively being discussed with the Allen County Health Department, and it raises concern because that's often the earliest indications of an increase. Now, how much surge we're going to find and how long it's going to last remains to be seen. But I think we can fully expect that if we have continued relaxation of social distancing and we do not have widespread or consistent adoption of the safety measures and behaviors that we've been talking about, guaranteed we will be seeing more cases of COVID-19 in our community.
Okay, so we are at the conclusion here with the time that we've had allowed for today. A reminder, we're going to share promptly all of the slides and questions that have information attached to them. Please don't hesitate to reach out to the Parkview Business Connect. You can see here on the slides the number that you can call direct, and you can also, I think, go and post information as direct or questions right on the website. Take full advantage. This is Parkview doing everything they can to help fight this COVID throughout our region, and make sure that everyone is equipped, no matter what sector you're working in, has information required to tailor these same principles that we're talking about again and again to various applications. So don't hesitate to reach out to our partners at Parkview and the Department of Health. Mindy Waldron, this is the first session I've been on where Mindy has not had a chance to weigh in. Do you have any closing comments for us today, Mindy?
I just appreciate the partnership that we've had with you all doing these webinars, and that we're all kind of hopefully on the same page and talking to the community in a lot of these sectors. So I do appreciate all the partnerships that we've had. And if there's further information needed, I've been speaking with some of these folks on this call. They've called already, like what would we actually do if you had a case? And so those are slightly different than maybe what you heard today. So feel free to keep reaching out, and we'll continue to provide information or walk you through those scenarios. Glad to do that.
Thank you, Mindy. Thank you very much. And the partners have all been great to work with. Again, I think this is an absolute best practice in Northeast Indiana, the way we've been Allen County Health has been pitching in, Parkview Health, GFW, the regional partnership, all been working together on this to make sure that this we can get the economy open and protect our residents and all the workforce that we can all get back to living a normal life. But the fight is not over, so let's stay vigilant here. I also want to again thank, I'm going to mention Matt Holycross, Dr. Board, Jolyn Suko, Dina Jackway, and Dr. Mike Nip, all of you for participating. You guys have just done an incredible job responding to various questions from all different angles on our fight against the COVID. And with that, a reminder, you'll get a survey real quickly and a link to the information, the slides and so forth. We want you to take full advantage of this and use to help us get this job done and done right. Again, thank you so much for being with us today, and be safe.